Good morning, everyone. Thank you for joining us. I am so incredibly pleased and honored to be here today as we launch the Integrated Care in Bermuda, Understanding Prostate Health booklet today. This booklet is one of the recommended deliverables from an extensive piece of collaborative work on the integrated care pathway for prostate cancer. It has followed a similar process to the integrated cancer care pathway completed for breast cancer, and it is just as important. Whilst breast cancer is the #1 cancer affecting women here in Bermuda, prostate cancer is the #1 cancer affecting men. In fact, in Bermuda, it makes up 33% of cancer diagnoses in men, with over 50 new cases identified each and every year. And why it needs our attention now is that the mortality rates here in Bermuda for prostate cancer are twice that compared to the OECD average. It is critical that we understand and improve care pathways for prostate cancer so that we can deliver the most effective screening and the best, most efficient treatment for men who are diagnosed. Our goal is to also improve outcomes and share information about what can be done to understand and reduce the risk of developing prostate cancer so that men and their families can make well-informed decisions about their health. The integrated pathway work for prostate cancer is led by the Bermuda Hospitals Board consultant urologist and founder of the Daily Mail charity, Dr. Jonathan Makanjuola, supported by KPMG and in partnership with patients, local urologists and oncologists, clinical specialists, and primary care representatives. It is one of a number of integrated care pathways that BHB is working on under the leadership of the CEO of BHB, Scott Pearman, and others that are also being led by the Ministry of Health. I very much want to extend my gratitude and the gratitude of the Bermuda public to the communities and the patients and the healthcare providers who have worked on this pathway, and thank you for helping to protect and improve the outcomes of the men in our families. Thank you.
Thank you, Minister Wilson. I am extremely proud to being able to hold up a copy of the Integrated Care in Bermuda, Understanding Prostate Health today, and share more about the work being done to develop effective integrated pathways to improve healthcare screening, treatments, and outcomes for the people of Bermuda. Bermuda Hospitals Board wants to see the best possible outcomes for its community. This integrated prostate cancer pathway follows on familiar work completed for breast cancer that has seen improvements in the pathway for women. We also are working with Johns Hopkins on pathways for trauma and burn care, which will also help to improve the efficiency and effectiveness of our trauma burn response. As the Honorable Minister has noted, it was important to do prostate cancer as the #1 cancer diagnosis for men in Bermuda. Our plan is next to complete a similar integrated care pathway for colon cancer. The central purpose of the cancer pathway is about making a difference in the lives of people in Bermuda. We want to make screening more effective and available to catch cancers as early as possible, and when there is the best chance for a full recovery. We also want to raise awareness about risks and prevention and to improve the care pathway for men diagnosed with prostate cancer so that we can improve outcomes and save lives. It is BHB's vision to pursue excellence through improvement. And at BHB, we believe that improvements require listening to and understanding the patient experience. It also requires working in partnership with fellow providers and other experts to ensure a coordinated and a collaborative pathway can be developed that reduces duplication, avoids delays, and keeps the patient at the heart of all that we do. So today, I'm proud to see this work is progressing and making a difference, and thank those who have been involved in developing the pathways. Concrete improvements are being made to help to save more lives. I would now like to hand over to BHB's consultant urologist, Dr. Jonathan Makanjuola, who is also the founder of the Daily Mail charity.
Thank you, Minister Wilson and Mr. Pearman. The work on the prostate cancer integrated pathway started just as I came to work in Bermuda in 2022, and it was really good timing. This process has been a great way to look at what we can improve in prostate cancer care and the care of our men on the island. Improve screening and make sure men get the diagnosis and treatment they need in a timely manner. We know that early diagnosis makes a massive difference in outcomes. And as the Honourable Minister has noted, we had very high mortality rates compared to other OECD countries. Thankfully, this is a downward trend now. The state of prostate cancer in Bermuda was mapped from 2022, revealing key opportunities to improve the pathway, notably early detection, standardization of care, and more importantly, patient support. The pathway has already been updated, and I'd like to thank Dr. Fosker, Dr. Brooks and Chawinski, and the team from the Ministry of Health for really helping to sit with us and go through the pathway and make sure it was fit for purpose for our men. One of the most personal improvements I've really been proud for is setting up free prostate cancer screening for the men of the island with the Daily Mail charity. To date, we've screened over 250 men on the island in 2 years, picking up 10 cases of advanced prostate cancer in men with no insurance. Connecting with Bermuda Cancer and Health, we've been able to offer them free treatment and positive impact their lives and save their lives moving forward. We've also increased the conversation of prostate cancer awareness, and now men are getting checked and are more comfortable to talk about these conditions to their loved ones. This work has also been able to help us standardize PSA screening guidelines. Now, why is this important? Traditionally, doctors have come from different jurisdictions in Bermuda, everyone learning from their own backgrounds, but there has been no unified Bermuda-specific guidelines, which is what we've done today. And this is actually a first in the Caribbean. I've met with my colleagues across the Caribbean, and Bermuda is a leader in integrated guidelines for their population. With help of local urologists, oncologists, and other key stakeholders, we had a number of workshops where we looked at screening, discussed it, and tried to standardize the way we do things for our population locally. The early phase of the work identified how prostate cancer was in our community, looking at actual data for the last 10 years. We had conversations with stakeholders, survivors, and I would like to mention Prostate Awareness Bermuda, who are a group of men who have survived prostate cancer and offer support to men. They were very instrumental in helping us design the booklet. As a result of the guidelines we published today, this is a resource for all men, available through your GPs, through the hospital, online. This is really a footprint and a good guideline so men understand what's available in Bermuda and understand the latest in technology and how they should be treated by their doctors when they come in. So the message I'd like to leave with you today is, if detected early, we can cure prostate issues, including cancer, and it's very, very treatable. So men, you should not be suffering in silence. Please read this guide or share it with a man in your life. And we hope this information will really empower you to take charge of your prostate health and encourage you to make better decisions when it comes to screening. Together, by staying informed and proactive, we can make a big difference to men's health in Bermuda.
Sorry, Albert Solomon from the Royal Gazette. I'm just trying to find out, in terms of outreaches or reaching the community or spreading awareness. In terms of awareness,
yes.
How does the Ministry of Health and the hospital plan to spread this information as in the pathway to the community?
Well, I can start by today and you joining us. Obviously, this is an important document that we want to ensure that members of our community, in particular our men, feel comfortable speaking about prostate cancer. But when we speak to the community and we have your audience and members of the public that will be able to see this, they'll be able to understand that not only, as the doctor indicated, that this is a public document that will be made available in their doctor's offices, it will be made available online and so forth. So it's widely to be shared, and we're encouraging everyone to do so. Did you want to add?
Yeah, and also I'd like to make this announcement that the Daily Mail charity is officially partnering with Bermuda Hospital Board to provide Bermuda's first mobile screening bus. It's fully paid for through the generous donations from the community of over $200,000, and the van is now being manufactured in the UK, and the van will be shipped here in Bermuda in the next 2 months. This van is a community van for all of Bermuda, and it means we can travel around the island offering free screening, testing for all diseases for all our population. So we're really proud of the work we're doing, and thank BHB for collaborating with us for this.
All right. Can the BHB comment on Mr. Pearman, on the patient support efforts that have been made over the years or in recent years in collaboration with the Daily Mail to support those patients, those who've been diagnosed with prostate cancer?
Okay, so thank you. So as you know, the Bermuda Hospitals Board is responsible for providing acute medical care. And one of the risks that we have seen over the last few years is we actually want not to be used for acute care. And so by helping in collaboration with the Ministry of Health, building integrated care pathways that have a focus on understanding what our population health risks are, ensuring that there's screening for the appropriate groups, early diagnosis, so that any early identification can hopefully first be resolved in the GP community, or if you have to get acute care, it's at the lower stages possible. So that's very important for breast cancer and as well as prostate, where in Bermuda, we see a lot of emergence at stages 3 and 4. What we would like to do, and by these partnerships that we're building, is really prevention first, and then early identification, which means better quality outcomes for the patient. Okay? Thank you.
That's it.
Can I get a picture of the three of you together? Actually, holding the guide and holding me. Come in front of the. Oops, I'm sorry. I've got a. There's. And let me do the guidelines as well.